Welcome back to Practice Underwater. I'm here with our real doctor, fake name, Alejandro. And I really like the name, but we won't get into it again. If you listen to the first part, we did have a little bit of back and forth about how much we enjoyed the name Alejandro. But for anyone who didn't listen to the first episode, I'm going to go ahead and just kind of walk through maybe that discussion that we had with Alejandro. Maybe it was last week, maybe it was before that. Um, and then for anyone who did listen, this may be a little redundant, maybe a reminder. But Alejandro is somebody who's been a practice owner for 20 years. Alejandro bought the practice 20 years ago, and it was marketed as a fee-for-service practice, but it actually was not. It had, I think, maybe like one insurance plus Delta. And over the years, Alejandro just worked in the practice, took the insurance, and then about 4 years ago, shortly post-COVID, Alejandro dropped Delta and went fully fee for service, and that was a pretty impactful moment for Alejandro in their practice because he went from maybe having a lot of patients to having there was patients who left, and Delta we talked about it on the last episode, but they don't make it very easy to go out of network, and so it ultimately led to patients leaving, and that was 4 years ago, right? So kind of the aftermath of that has already been spelled out. Whatever impacts that it would have already, whoever's left has left, whoever's staying has stayed, and it's kind of not really relevant today, but it was a big part of how we got to where we are today. And Alejandro's practice, two front desk team members, two assistants, one full-time hygienist, and 4-day-a-week hygienist, and we're about to have a second full day a week, or second hygienist start 2 days a week this summer. And so, that's where Alejandro's at. And last episode, we really talked about, I really tried to get to understand Alejandro as a dentist, what his goals are. And, really Alejandro in the simplest sense is I would very, very squarely call Alejandro a productive solo personality. And, that would be the vision avatar that we would assign Alejandro. And, what he wants is just a Monday through Thursday busy schedule with two hygienists, really passionate about doing high quality restorative dentistry and, having that strong doctor-patient relationship where you see one patient at a time. Take your time, do good dentistry, have a team where you're doing well enough where you guys can do some fun things, minimal drama, and, just enjoy practice. And I think Alejandro thinks that he's got maybe 10 to 15 years left. He's paying down some debt. He wants to get that debt out of the way and then, see kind of what goes from there. But he doesn't really have an end in sight. I'll put it that way. And that really brings us to where we are today. Now, the one other thing that we talked about just from the last episode. Again, if you haven't listened to it, I'd encourage you to do that. But, we'd say like, what's in the way? And there's really two primary things that are in the way from where Alejandro is now to where Alejandro wants to go, which is one is the keeping the schedule full. And, that's mainly on the doctor side. The one hygienist that we have, they've got a full schedule. And the second one is just the managing of the team. And I think that that's probably everyone's pain point, that manages a team. But, it's just that team management component and having that feel sustainable long term. So, for me, just kind of giving a preview, I'm much more interested in the schedule being full. And I have a lot of thoughts there. But I think, we're going to start in that conversation and then we're going to move our way to the team because we could talk the whole time about the team. And, I don't know if a whole lot's going to change or move the needle for Alejandro in that conversation compared to that second hygienist coming on and the schedule being full and all of that. Like, I think we have a greater discussion there. So, Alejandro, from your perspective, that summary complete? Anything missing?
No, it sounds pretty complete. The only one thing I would add to kind of help with the talk would be I am in the process of merging another doctor's charts into my practice too. So that I think is something that we can talk about too this time.
Yeah.
It kind of
We ought to talk about that. We ought to have talked about that last time.
I
Maybe.
know. It's just one of those things we got into other things, but it just kind of came out of nowhere, and it's interesting because he is not, he takes insurance, but he does have, a couple hundred uninsured patients too.
Yeah, maybe talk to me through this wrinkle, right? I think this is pretty pertinent to the schedule being full. So
Mhm.
tell me about this doctor's retirement and what you're doing and how you're acquiring the charts.
I mean, actually, just kind of just fell in my lap. Someone, a friend of mine, had mentioned, "Hey, I know this guy's looking to be retiring soon, and you should just reach out." And so I did, and next thing I know, I mean, it was kind of like we just agreed basically on, hey, he's gonna refer patients, send a letter, and then I get X number of dollars per patient. Just give him per patient that he refers to me. So just to kind of see, and he basically told me, hey, there's a lot of patients that need a decent amount of dental work, and this, some of them are friends of his and things. So I feel like that should definitely be something that helps fill the
Yeah.
schedule. Okay. And it just, be me, him being a network with a lot of insurances versus me being fee for service. I'm not sure how many we're going to get, but we'll do our best to try to bring people over. And he's kind of close to me, but not that close. It's like, I think it's about 5 or 6 miles, but given the proximity of how to get to my office, it's an easy drive, basically.
Yeah. So maybe kind of walk me through. So let me just for our audience. So here's my concern. So Alejandro in between recordings actually made a comment that is very pertinent to me. So, our rule of thumb is that you need 200 patients for every hygiene day that you have. So right now Alejandro has 875 active patients according to the practice by numbers that I'm looking at. So in the last episode, we talked about that one full-time hygienist, and I asked, like, is this person busy? Anecdotally, kind of just walk me through the schedule. And Alejandro did talk about how this person is busy. Their schedule is full, and it's sometimes hard to get new patients in. It's sometimes hard to get SRPs in, and that matches very closely with what I'm seeing. So now when we go and add those, so that's because we have capacity in terms of like the number of appointments that we offer with that one 4 day a week hygienist. We have 800 potential patients that we can serve, and we have 875 active patients. So like we're a little bit over in terms of the number of patients we have compared to the number of providers and openings. Then we're now adding a 2 day a week hygienist. So we're going from 800 patients that we service to openings for, you add 400 to that. We're going to go from 800 to 1200. And Alejandro, you made a comment earlier about how you've had the second hygienist in the past and you've never been able to really keep them full. So can you just elaborate on that for me?
It seems like we've in the past, I've probably for a good 10, 15, 10, 10, at least 10 years, I've had two full-time hygienists, and it seemed like there would always be openings in the schedule, and normally I was talking, I actually ran into one of my old hygienists, I'm like, just thinking in my mind, why didn't she stay? It was always because I always had the one that was kind of the one that's the most, I don't know, the one that's been there the longest, and she would get the majority of the patients, and the second hygienist they'd be busy, but, not for a full 4 days, and I think eventually that hygienist would move on for another opportunity maybe while they were full, like, completely packed somewhere else, and I think, that definitely made me think about, well, we just need more patients in the practice. Of course, then we drop Delta, which isn't necessarily the best way to do that, but we're at least getting paid more for the patients that do come. So,
Yeah, so I think that that's an important element that I want to throw in here. So, real quick though, what do you pay an hourly hygienist? So this
uh,
new hygienist for 2 days a week, how much are you paying them per hour?
50.
50. Okay.
Yeah. Yeah.
So now I anticipate, and I'm not sure if you do too, but I am anticipating that you will have openings in their schedule. So, now you've read Dental Moneyball. That's something we talked about in part one. So just kind of walk me through your mental preparation and preparedness to see openings in your second hygienist schedule. Are you prepared for that, or are you expecting them to be full right away? Like, what are your expectations heading into this?
But one of the things that I really, and it's been a hard thing to do because I haven't had the hygienist yet to do it with, is I want to be able to, like, organize the schedule so my current hygienist actually has openings for new patients. Because right now we are getting new patients and they're getting put into my schedule, just random patients that like should be in hygiene. And so I think if my existing hygienist has some more blocks in her schedule and can see more new patients, then we can put some in the other hygienist schedule. So I feel like there will be openings. And I actually am okay with it, because I feel like it'll let a lot of times the overflow of those new patients is all falling on me now, and I'm just having to see these just random appointments, and it's like I think people that would probably be better off just spending time with the hygienist, and I think, but that's where I really think having this other dentist's office that I'm taking over some patients will help.
Yeah, I think that that will help quite a bit. And just for my like edification, do you have like a script or some type of process that your team communicates with insurance patients?
Yeah, we will, like, we just kind of as far as, like, if we're in network, but just we're out of network or basically,
Yeah, I mean,
I
like,
think.
because these patients, a lot of them are used to the practice taking insurance, and then the retiring dentist whose charts you're hoping to assume, they may not take insurance. So what's the plan on how you're going to communicate that to those patients to hopefully encourage them to come into your office?
I think, over the years we've kind of changed it a little bit, but I think just being upfront with them is the best way. Like, hey, we're out of network with your insurance, but we do have a lot of other patients that come here that do have that insurance, and we'll do our best to file your insurance for you and make sure make sure we utilize your benefits to the best we can, and you know and then we'll go over, like, what their maximums are and everything, and, that we can't guarantee exactly what they're gonna pay, but we'll, estimate the best we can. Now, the Delta patients are a totally different story because then you kinda just have to say, "Hey, we're you're gonna have to," Delta has chosen to reimburse, it reimburse you, not the practice, and that we'll do our best to file your insurance still, and maximize all the benefits you have, but that you would have to prepay for your appointment, and then Delta will actually reimburse you. But we do have payment options available if you'd like to, break those payments up or until the insurance check comes to you, and and I think what I found is that most like there's a lot of, like, generally your reasonable patient will understand that, and then but some people just they either want to totally be a network or they just will not pay upfront for if you're Delta. So I'm anticipating I'm not going to get a lot of these Delta patients unless they're actually patients so he's really talking to all the patients and saying, hey, certain patients he's telling them to come to us just because he knows them really well, and then he's going to actually become a patient of mine too, and just kind of ease them along into the practice. And he is, but yeah, this insurance question it's a tough one. It's just, I think we're used to being out of network though, so I think it helps. But that's going to be a tricky one. I think, we're going to definitely have to go through that process a little bit more. But I think we're used to talking to all of our patients that way. So I think it makes it a little easier. Like, I mean, they're coming from his office, but they're still just a patient calling saying they have X and X insurance,
Yeah.
but
So when is this person retiring and sending the letter and trying to send everyone your way?
it's all going on right now. He's actually he sent me a picture of the box of letters today. They're gonna get sent out, and then he's retiring June 1st.
And when
And
does the new hygienist start?
I think it could be sometime in July, but it might be the first week of August, depending on when she gets her license.
Okay.
But
So just a heads up, um, you're gonna want to put her on the schedule sooner than later. Not saying
okay.
like put her on the schedule before she gets her license. I'm saying like have a start date in mind
Uh-huh.
and like begin opening those appointments because like you got to start filling the schedule. And then you're gonna have all these people calling, and you want to be putting them on the openings, right? So just kind of keep that in mind. Is that because one of my so let's take a step back real quick and connect this all to your vision. So right now you've kind of came with the pain point that says my schedule is not full. And I just want to like provide the diagnosis on that I see. So, you know, Alejandro is a dentist who does primarily restorative dentistry. Alejandro does not place implants. Alejandro's a love-hate relationship with endo, not a huge surgical component. So like on the scale, Alejandro's going to need more patients to keep a full schedule compared to the type of dentist that does the entire spectrum of procedures available. And so, for Alejandro to have the type of schedule that he stated he wants, I would anticipate that's going to come close to the two full-time hygienists, where you're checking for both of your hygienists, you're doing your procedures, you've kind of gotten your flow, and then the schedule is full. So, the concern that you have about keeping the schedule full, I would say that that concern is primarily because of the fact that we don't have that second hygienist in the practice, and just a single doctor with your procedure mix with one full-time hygienist is just that math doesn't work super well. So that second hygienist is an essential part of the completion of this vision, because we need to get that second hygienist full so that you're walking into enough exams every day to have enough crown and bridge to be having that be a daily driver activity for you, where you're very pleased with the amount of volume that you're doing on your side of the schedule. So before we get into like all of the mechanics and anything more deep than that, are you clear on, I guess, how that works? How that I view that as the bottleneck for you to your doctor schedule being full is the fact that you only have one hygienist and your procedure mix. And I don't want to change your procedure mix because you seem very happy with that, and I have the same procedure mix. So like, I'm not going to try to change it. So the thing that's got to change is the second hygienist. So, just make sure we're aligned there before I keep going.
No, definitely. That makes a lot of sense. I think you really understand kind of where I'm at, and that's why I feel like if we can add the patients in, then it can really help. And I feel like this doctor's patients, he was kind of the same. He's actually doing his own hygiene too.
Yeah.
So it's like and he's doing restorative, but not as much crown and bridge. And he even told me there's a lot of like work that needs to be done on some people in there. And so I think, but they do get, they're used to seeing the oral surgeon that I know for implants. So they're used to he does restore a decent amount of implants. So it's kind of he even gave me, 4 or 5, I think 5 different charts, and 3 of them are implants that need to be restored already. So,
Wow.
so, so I see it's like, I feel like a good match for us, as far as what I want to do.
Yeah, and so then, so the first thing is, are we clear on where we need to go and why?
Yes.
Check. We've got
Yeah.
that.
Got
So
it.
then the next thing that was on my list is, are we clear on how to talk to patients about insurance? Check. Like, your answer was excellent. And I think that it's very clear that you have a lot of experience operating a fee-for-service practice. Like, you've been doing this for 4 years now. Your team has been doing this for 4 years. You guys know how to have the conversation, and you have the correct intuition to not change your script. Be upfront, be transparent. Because if you try to like deceive people, then it's just going to come back to bite you in an unhappy patient later. So it's just better to be very upfront with people and also have a diplomatic way of sharing it, which you nailed both. So I think that the way that you're communicating, also spectacular. And so I think that we're really going to be looking for a few things. So you said that you have a scheduling coordinator up front. So what we're looking at now is we're adding those 2 days a week in hygiene. And the way our philosophy works is you're going to have to fill those 2 days, reappoint those people, and then you're going to expand to 4 days. So like that's the path to get us to where we want to go, is we're going to add the 2 days of hygiene this summer when our new hygienist gets their license. Then they're going to fill up that schedule, keep reappointing those people, and then we're going to move to adding 2 more days. Once the schedule shows that it's full on those initial 2 days, then we're going to add those other 2 days. And now you're going to have two hygienists, each working 4 days. And then your schedule is going to be full just due to the number of exams that you're doing. And so that piece that I'm interested in is, how are we going to fill this second hygienist's worth of patients? Because we have 875 patients, which means that's like 800 patients for one full-time hygienist. So we have 75 patients of the 400 patients that we need to fill the second hygienist. So the big kind of crux of this is really going to come into, how do we fill this schedule with new like we're going to need new blood to be coming into the practice. And the retiring dentist is an excellent solution. And we've talked about that, right? The letters are going out soon. And that's why I'm suggesting that you need to open up the schedule on your calendar so that as the letters go out and people call, your team's like, yeah, we can get you in. And like maybe I don't think these patients are going to mind waiting. But if they do, you can put them on the ASAP list. But like, I think that most people will be fine waiting until your openings with your second hygienist, and you should try to push patients to the second hygienist. And I think that most patients, I know that this might sound odd, I think most patients will prefer having a hygienist do their visit than the dentist. I just my guess, it could be totally off, but I really do see that happening. So I think that you should be trying to use this retiring dentist as an opportunity to add as many people to that second hygienist schedule as possible, because you're kind of behind the eight ball a little bit on how many patients you have to put on that person's schedule. So, just kind of thoughts there.
No, I think that's a good idea. I think that's very, very good idea, opening that second schedule sooner and just kinda just figuring out how to organize that and because that's yeah, then it lets us get because he has like an appointment book of like people that are coming in, so we know there's people coming in, and I think it's I think it'll be good that when they call like, hey, we can see you in August 1st, and or August,
Yeah.
we can find time and honestly, if for I if I need to, I mean, I don't if something gets delayed with the license or something, we could always get a temp or something to come
Yeah,
in if we needed
exactly.
to, especially if the schedule's full. It's no, I think it's good.
So
I
then
think, yeah.
there's something that I just want to say, like, because, you know, we're essentially, we know that we have some excess capacity with your current patient base. We don't know how much. I'm quantifying it as potentially 75. So I don't really know. But, um, like, I think we need to give it 6 months of maybe like 4 to 6 months of the second hygienist at 2 days a
Mhm.
week before we begin the marketing valve, because I think marketing in your situation is a little challenging because, like what you said, the fee for service component of it, right? Where you're marketing for all these patients, and then, like, you're essentially, it just, I don't necessarily want to jump straight to marketing. I want to give it a period of trying to get those 2 days full with our internal opportunities, whether the patients who are already in your practice, maybe, having more room for SRP and having some new patients go to the second hygienist and getting that retiring dentist. Like, let's see how far we can go on that side. And just maybe, but then at that being said, like, marketing is on my mind. So just kind of talk about your Google review presence. Do you have much of a Google review presence website? Let's just kind of talk a little bit about what you do on that side.
Yeah, I feel like we've done pretty good. I mean, we've done, I've always kept up with the website. I think we have about almost, I think we're almost to 400 Google reviews, 4.9, I think they're like 4.9.
Oh, good.
I think that'll help bringing in the more new patients you can get in. That'd be nice. I think gives you more opportunity to get more reviews. And I think we still, we're getting a decent number of calls just from like our organic marketing. We do a little bit of Google AdWords, not a ton, just I think it's like $500 a month or something. It's nothing too big, but we do. I mean, I think most of that, if we get 19 new patients, I mean, probably half of that's probably, from the marketing, from the Google, or from just external, maybe 10, 15 from external sources. We could probably
Yeah.
get more referrals too, that's all internally. Like I was thinking that these new patients that are coming in could be a good way to get more referrals from other patients. That's something that I think we could I'm always need help on asking for referral. That's always been a tricky situation in my
Yeah.
office. We do like referral contests and things like that, but it's just that I think asking for reviews and Google reviews and referrals has always been a hard thing to get people to do.
Yeah. And I think that, for you, it's going to be a more patient approach where you need to, like, obviously, I think an easy thing that you could do, let's just say you're 2 months in and you're like, man, this is really not working. The second hygienist schedule is really not filling up. then you maybe increase the Google AdWords budget a little bit, ramp that up, try to get some new patients in there. But, I think for the most part, like, I would really encourage you to open up the schedule 2 days a week, see what happens, try to get this retiring dentist's patients on there, and reevaluate and go with the more patient approach. And, I'm looking here at your practice by numbers, and you have a very interesting hygiene situation. So when I look at your hygiene pool, I see, and I don't know how, sometimes the available hours on practice by numbers aren't the most accurate, but it looks like of the 126 available appointments, there was 103 hours filled. Does that sound about right? Like 20, 25, 20, it seems like 23 openings in the last month?
In hygiene, I mean, does it go back and count the no-shows and cancellations and things like
Yes.
that too? Yeah, I mean, it could have been. Like, we do have days where and there's also another hygienist that the other hygienist is working some hours too, like the cut back
Oh,
2 or
got
3
it.
days. Just I think she worked like 2, maybe 2 days, and we did open and we were open part of Friday last week or last month too. We opened one Friday.
Okay. Yeah,
Um,
so, it seems like it's about right. So, I think we're definitely, I think we've assessed it properly to think that we're going to have to me maybe a bit of a challenge filling the 2 days a week that we're going to be opening. But don't be too concerned, because when your hygienist does see a patient, your average hourly is 244. So, like, put that in perspective. When I bought my practice, and PPO, I'm a PPO dentist, kind of that's just my shtick. But, like, we were at maybe 110 an hour. It was like 100 to 110 an hour was kind of where my hygienists were. And, we worked hard, perio, fluoride, insurance verification through x-rays. Like, we have a system now. And, our hygiene's hourly production is around $160 an hour. And for us, like, we consider that to be like a big success. And, you with fee for service are at 240 an hour. So think of that like the dental Moneyball, dental 3-pointer value of a new patient. I mean, we talked about it in part 1. You talked about that was one of your takeaways from the book. You know, your hygienists are $50 an hour, and your average hourly is 244 an hour. So, like, you're doing, like, you have a lot of leeway for those openings. And you don't want to use that. You don't want it to be like, man, for every 1 in 5, like every 5 hours they're seeing one patient. Like, you don't want that. But that's your true break even, just on the not even counting the treatment presented, which is honestly a bigger factor. But so I just want to say that to make the point that this is a situation where I think we can be patient, because you're going to be doing well no matter what, because even if you fill some openings, it'll end up making sense. And so, I would really encourage you to take a open up 2 days, let's see what happens, be calm the whole time, and then you have kind of these dials you can turn, with one of them potentially being the AdWords budget. But I would really encourage you to, like, before you do that, to first just watch and see how it goes. And so, I think that that's like the biggest thing, in my opinion, holding you back from where you want to be. And so it's like, to get to the 6 days a week of hygiene, where you have one full time and one part time 2 day a week. You're going to be looking at 1,200 patients. Right now, you're at 875. So you have a gap to go for there. And then you also have another, hurdle to get to the full time, which will be around 1,600 patients. So, you need close to double, not quite double if you're doing a great job of, like, being efficient and reappointing and having a tight backdoor. But you do need close to double the number of patients you have now, to really be a fully fledged, productive solo with the type of schedule that you're looking for. And so you just got to begin that process. You got to open the schedule. You got to get people on it. You got to reappoint everybody, be great with your retention, and then, move forward from there. So, I think that, like, that's like the big thing that is taking you to where you want to go, is the 2 hygienists full. So do you have any questions about the path there? I feel like I've kind of tried to explain all of it. I think that that's all I really have to say on that topic. Is it clear to you?
yes, yeah, it seems very clear. I mean, it's just I think being patient and just taking our time, bringing those, opening that schedule, and then bringing the patients from the other doctor's practice in, as many as we can, will be key, I think. And the nice thing is, like, we've even though, like, we have, like, he's sending all of the letters. There was, I think he sent out like 900 and some letters. So I mean, I don't know how who it says they're within so many they've been within 2 years, but you know how that works. You're not sure how active everybody is, but no, I think it makes a lot of sense.
Okay, now I want to focus on the team. So, you talked about team management being another pain point, and I really like your bonus structure. I don't necessarily want to deviate from it. I don't think that's really where our conversation is best spent. I think that I'm interested in where you think your team. What types of changes do you want to have? Like, where's the pain points? Help me understand the team pain points a little more.
Well, my biggest pain point is my lead assistant's going to hygiene school, so that's my
Ooh,
yeah, she's great too. She starts in September, so I'm gonna need to find a new assistant. And the other assistant, she's great, but she's fresh out of school, and she's just learning. I mean, she's catching on quick, so I think I need to find someone with some experience that can kind of step more into that lead role.
that's
But
tough.
yeah,
Yeah, that's a tough one. So is that the main issue?
that and the other thing is, I would say, is the scheduling coordinator. Um, Two things on that front. One, she's not always the most urgent with filling anything. Like, there'll be openings and she doesn't call anybody. I'll
Yeah.
have to go up there, and not that she necessarily always has the list. And we just got practice by numbers, so we're still trying to figure out how to but it just is, there's no urgency. Like, it'll just be open until I go up there and say something. And she's also pregnant and due at the end of July.
Ah,
So there's so we're trying to figure out how to navigate all of that. Like, and I only have one other front office employee. So I
is she
think,
coming back or is she leaving?
we think she's coming back, but we're we're not we're not 100% sure. Like, we think so. I mean, everything. I don't have no reason to think she's not, but she hasn't even. We're going to talk about that this week. Her make have a leave of absence form and everything, and her try to finalize what she's actually doing. But I so that's kind of a tricky situation. Like, it's and then, its thing is, I don't know, before she was pregnant, I feel like, so maybe some of it's on being pregnant. I don't know. Like, she's definitely was, I feel like, more like on the ball of things beforehand. And she's got a lot going on. But I I don't know. We definitely need that urgency to fill the schedule that's so important for that
Yeah.
role.
Well, I think that, think about it, right? You're about to add that second day, 2 days of hygiene. And if the first thing you're talking about is the scheduling coordinator's lack of urgency to fill openings, like that could be a bit of a problem heading into much more openings. So, that's something that, um, you know, yeah, I think that there needs to be some work here. Where and the thing about practice by numbers that's great is you can actually, like, I can go into I'm in your account right now. Like, I can go in there and I can pull up the list and I can see, and then, like, you can directly call people and you can make comments in here, and so it's like there should be no questions as to like there's a performance tab, and you can see, like, how many attempts were made, how many patients answered, how many, like, if you're really utilizing the software properly, you should be able to have all of your performance management of the scheduling coordinator be within the software. Like, that's kind of how it should work. So, I think that, like, if I were you, because right now you kind of have like a stagnant or like patient base size, and you need to have a growing patient base size, and so the scheduling coordinator is one of the most important positions for you. Your treatment acceptance is great, right? So the treatment coordinator, they're not necessarily the problem, so to speak. Like, they're doing, the numbers say that that's a strength in the practice. And so I would think that in this situation, like, it's yeah, you kind of have, sometimes practices go through inflection points where it's like things are stable for a long time, and then kind of all at once things tend to, like, shift. And it seems like you have the lead dental assistant going to hygiene school, you have the scheduling coordinator who's pregnant, who's going to be out, and then you have the new hygienist coming in. So it's kind of it's like one of those times that things are shifting, right? And it's more than just one position. It's, half of them. So, I think that that would be just that would be where my focus is, if I were you. And I think that that's obviously an area where I think we could really help a lot. Like that's what we do. But I think that at the end of the day, what you need is you need to have each team member have a very clear understanding of what they're doing and have each team member have a way of being held accountable and have it be measurable. So, for example, something that I used to do with my scheduling coordinator was like, we would want to make, we would give a target for the number of attempts we would want to make per day to fill the schedule, right? So, and then we look at the end of the week. All right, how many attempts were made? What was the success of those attempts? Are they all documented? It's just all like very straightforward, right? So I think there's just maybe some clarity that needs to be given between roles and responsibilities, and say like, what we expect is that every day 20 phone calls are made to patients who are overdue, and those are documented. And then at the end of the week, if you worked 4 days, we should see 80 calls, and we should see what happened with those 80 calls. And then, that's just kind of how we hold somebody accountable for the position. And so I think that maybe some of that in that kind of just like infrastructure roles, responsibilities would be important, because you are heading into a time where you're going to have more openings on the schedule. And so you do want to be mindful of the fact that you want to have your team members putting in the inputs that will lead to the outputs that you're really looking for.
No, that's a good point. I like that idea, having that accountability for the amount of calls. And I think one of the other issues is sometimes I think it'll help when we have more openings, honestly, because she does bring in the new patients pretty well. She's good in her, talking with them and getting them on the schedule. It's just having somewhere to put them all the time is tricky when we don't have the capacity. So she'll be able to put, I think she'd actually be good at that part. I think getting them in the schedule. It's just once they fall off or like that. But like I said, it all works together because we've got to keep that new hygienist busy even
Yeah.
after we bring new patients in. So no, I like the accountability though. I think that's a great idea.
And the other thing with the DA, I think you're going to need to make a determination relatively quickly on if you feel like your current second DA can elevate into the lead DA, or if you feel like you need to bring a lead DA from outside.
Hmm.
But that's another thing that I wouldn't wait until the last minute to try to make that hire.
Yeah.
I would rather, if I were you, if you're going to go and hire that DA from out, I would
Uh-huh.
rather have a period where they overlap,
Uh-huh.
and have a good pass off, even though it's going to increase your overhead. It'll like the most expensive thing that you can do is have an inefficient, like just not be able to do the dentistry that you need to do, once your
Yeah.
DA leaves. So, I would really, DAs are tough to find. So I would really
Yeah.
not try to wait to the last minute on that one.
Okay, I was thinking that too, because then she can learn from like how we do things and kind of just fall into our system instead of bringing her in too fresh, and then it's like she's gonna want to change things, maybe
Yeah,
potentially, and don't want
exactly.
that.
Yeah. And, so I think that it seems like your team is honestly higher performing than I think that you do a good. I think fee for service practices naturally have to do a good job, right? So I think that like you have the daily grab bag. I think that that's a great exercise. I think that your primary points of needing to address on the team side are really, ironed out roles and responsibilities for the scheduling coordinator, and the replacement of the DA, and the filling up of the second hygienist. Like, I think those are your core activities, right? I think if you do those things, then, you're going to be well on your way to where you want to go, albeit at a slower pace. And I think that that's the thing that, is just important. Like with a fee for service practice, with the new patient flow that you see, like it's just gonna be a little bit of a slower path to get you to that two full-time hygienists. But, it's that doesn't mean that it's not available. You just need to kind of be patient and prod along that path.
No, that makes sense, and actually that's not a bad thing. It just keeps everything just going well, but just continuing to get better.
Yeah. And I think, if I were you, I would make sure that you have a clear understanding of, like don't panic if you see openings on the schedule, make sure that you're going in the right direction, and just kind of monitoring that process. And, that's ultimately where I think that you just need to be patient. and trust the process. And then, I think you just need to work your way, get patients on the schedule, have them reappointed. That retain open fill that we talk about in Dental Moneyball, you know, shoring up your retention, opening up the schedule, which you're doing, filling that schedule, and then reappointing those patients. Like that's really where you're going to be getting to where you want to go. So that's really what I have for you. Do you have any questions? Anything feel outstanding before we kind of maybe wrap it up for our audience?
No, I think you've really put it together well. I mean, I think getting some of that clarity on the team management really helped. I think a good start on Monday is just, we've been actually trying to work on the roles and responsibilities a little more. We have the list. We just need to put it together. And then I do need to just create a goal for her every week. Hey, you got to do this many calls to patients, and then we got to open that schedule.
Yeah,
And
and the concern with your end is, I remember one time I had a scheduling coordinator, and I'm like, you need to call 20 people a day, and she was like, well, I don't have 20 people a day to call. So you kind of also want to get an idea of how big is your overdue recare list, and pace it, right? Because you don't want them to call everybody in 2 days, and then they're thinking like, I don't have anybody to call. So I see here just on just the kind of opportunities, I see that you have 114, so you have like 95 people that are overdue 0 to 6 months, 48 from 7 to 12 months, and then 114. So like, you do have a couple hundred people to call, but those couple hundred people kind of got to last like 6 months. So, you just got to pace it a little bit so that they're not like, beating down the door of everybody. And then, you would probably want them to start calling shortly before the hygienist starts. You don't want to be calling like right tomorrow because you don't have openings and you're going to have openings in August. So I would really focus on first getting that schedule open. And then as it gets closer, then, start doing the phone calls and making sure that you have a process around it. So I think with the scheduling coordinator, I'd initially like tomorrow, Monday or whatever, I would focus on getting clarity on the plans, post delivery if they're pregnant. So like when that, wraps up. And then after that, then I would focus on, like that hygienist starting, getting those days on, and then, how are we going to fill those?
no, that's good. I think that'll help. I think the hygienist also has a few weeks available in June and July. Hopefully, she gets her license earlier in July. That's our hope. But she's actually going to help us out a few weeks in June, and so I think that could help overlap a little bit of the scheduling coordinator too, and in July she can help us. So
Yeah.
I
It
can
would be excellent if she could call patients to fill her own schedule. Now
that
that
would
would be
yes,
spectacular.
she can meet them and fill her own schedule.
Yeah, exactly. She's like, be motivated to fill her own book. So, well, I'm just gonna Alejandro, I'm just gonna kind of summarize this whole 2-part series here for our audience and bring us home. So, I think one of the things I really like about shared practices philosophy is I think we try our hardest to let the dentist who we are helping guide the show. And I think that for me, that's like my big takeaway from this kind of 2-part series is that I really don't want to change who Alejandro is. Alejandro is a restorative dentist who wants to be a productive solo, like in the most succinct terms. And the problem right now is that there's one hygienist and 875 patients. And with that procedure mix, it just doesn't lead to a full calendar. And, Alejandro does well, like 1.1 million is kind of the trailing 12 months. But that doesn't mean that that's, Alejandro now sees, I think Alejandro read Dental Moneyball. The philosophy makes a lot of sense. And, now sees kind of the avenue to continue to grow. And, I think that as we've spoken and talked about it, we've kind of outlined that path where it's really about getting to those 2 full-time hygienists where that restorative dentistry is going to be in enough demand to fully fill up a doctor's schedule. And I would anticipate, hopefully, that gets the practice to 1.5, 1.6 million, and that one patient at a time, slower fee-for-service pace but still having a lot of fun with the team and having things go well. We talked about the team elements of that, and I don't really think there's anything that's like on fire there. I just think that with the team, there's just a natural inflection point of change that's occurring. We have a lead DA who's going to hygiene school, we have a scheduling coordinator who's pregnant, and then we have a second hygienist who's coming into the practice. I mean, that's half of the positions in the office are going through some type of natural change. And so I think that, that's what really brings up the staff dynamics. But I think that in general, I was impressed with the scripts that they had on, how they talk about insurance with patients. I was impressed with the grab bag, the kind of the incentives that Alejandro has for the team. So I really do think it's, and I think that my big takeaway is that, Alejandro read Dental Moneyball, saw a different path, was hiring a part-time hygienist. And sometimes you just need to hear that, like, this is kind of what, I diagnosed the situation for Alejandro. I talked about the active patient base size. I talked about the number of openings. I talked about how this could potentially be an upcoming thing where, you're going to have maybe more openings. Prepared Alejandro for maybe seeing some openings in the schedule, but still having faith in that process and trusting it and continuing to proceed, and knowing that if you have those openings, you fill those openings, you reappoint those people, you do that again and you do that again, then you'll prod your way to that 2 hygienist practice. And I really see that as the path. It's just just a steady walk, patiently. And, I think the Google AdWords upping this marketing spend, if we really want to start, filling the schedule a little quicker, I think would be a good idea. But I think that ultimately at the end of the day, that's the path here. And I really appreciated how clear Alejandro was with, the vision. And, I think that we have a very straightforward path there. So Alejandro, I think, I like to end with takeaways. So I guess for you, it's been 2 parts of Practice Underwater. What's your biggest, maybe not singular, but just what are your takeaways from the time that we've spent together on air?
I'd say probably the biggest takeaway is that it's going to take some time. Be patient, and that we're doing good, and then they're actually doing good at what we're doing. It's just a matter of um, being able to open that schedule up and then get another hygienist full, and then slowly be able to grow. I feel like we're on the right path, and that I think that me being able to take over this as our office is a big deal because it's going to give me more. I need, basically in my mind, I was kind of thinking, hey, I need another couple hundred patients here to really get where I want, but it need to be even a little more than that. But I think between that practice and just natural marketing and bringing in new patients, I think we're on that path. And I think opening that second hygienist earlier than I may have opened up before the schedule is a good idea. That's really going to help. And that, you know, working on developing more clear roles and responsibilities as well is very important, and I think I need to. It's a lot of things on my to-do list. I just need to make sure I'm doing them. I think.
Yeah. Absolutely. Well, it was great to have you on Practice Underwater, and I feel like, it's always I never know what I'm gonna find when I do one of these, and I think that this was one of the more straightforward ones I've done. It's just patience. I think that you said it really well. Like, you just need to be patient and trust the process, and you'll get there. So, thanks for coming on. Thank you for educating our audience with you being a live example. And, we wish you all the best. And I think that from our perspective, I take a lot of pride in the fact that you picked up the book Dental Moneyball, and, you saw something for yourself there. Like, I'm holding it right here. But I think for us, we just deeply believe in what we do and how we work. And it's just so cool to hear that, it resonated with you as well. So thanks for coming on Practice Underwater. We really do appreciate it. And thanks for listening to another episode of the Shared Practices podcast. And we'll see you next time.
Thank you.